All right, everybody. So we are back and we have you for the next hour to dive a little deeper on data. Now, we've been kind of talking about data for the last, I don't know, what have we been doing this? A day and a half. It keeps coming up, and not that it's the only thing you need to think about in a vulnerability assessment. Remember those 6 steps? There's a lot of other things happening, but it's such, there's so much here to manage that we really wanted to spend some time focusing in on how to do it and give you a little practice with this process. I want you to leave here feeling a little more confident that of all these tools that are out there, you feel a little more ready to dive in and use them and start thinking about how they apply to your specific community and answer some questions you might be having about your vulnerabilities. So, all right, next slide, please. I've got some friends joining me for this workshop. So you already met Claudia Langford Brown from CDC. She's going to help me demo one of the CDC tools, and you've met Serena Vega, but I'm excited to have her here with me. She's been my sidekick on all things data development related for Tribal Climate Health Project. In fact, helping me with our easy tool, which we literally just went live with a new version of it. So we're going to share that with you a little bit today. And she's going to help me demo some tools with you as well. Because we don't have much time here, a lot of the deep dive into tool stuff is going to happen at lunch if you want more information. So remember, the geek out session is coming. If you're like me and you do want to kind of noodle in a little bit more, we're going to do it there. So this will be a high level overview. All right, so go ahead and go to the next slide. I'm going to just talk a little bit about data, and then we're going to get into this activity. All right, so if you're like any reasonable warm-blooded human, you have already noticed that the volume of potential impacts, especially when it comes to health and climate change, is overwhelming. And so we've showed you all these little maps and charts and cool things. Those are examples where there are really great data sets with really great visualizations attached to them that you might be able to publicly access without too much work. And so things like the CDC, these maps that you can toggle around with. So we're going to show you a few of those. We've heard it a lot of times already in this conference. How am I supposed to keep track of all of these data sets? There's tens of thousands of potential places to look under rocks for information besides all the information that you have in-house. And like we just talked about at the last session, we always put first what the tribe knows, whether it's in indigenous science or in its own traditional ecological knowledge. And where Western science and things that are publicly accessible can help, we'd like to point you in the right direction where you can find it. Next slide, please. So that's the entire theory behind this easy tool we've kind of kept talking about. And I just want to share with you a little bit about it. And then we're going to demo it for you a little bit deeper in the lunch session. So the main point there is that overall, the course of trying to learn as much as we can about where the information lives, we had to organize it in some sort of a reasonable, meaningful way, because there's just simply too many places to go. How do you navigate to all of it? So the exposures, impacts, and strategies inventory was a place to, like it says, inventory and kind of create a large menu of all the data that we could find that's related to vulnerability indicators. So exposure, we go by each of those 5 exposure areas that we keep talking about. We connect them with what the research is showing us, where the secondary exposures live. We connect those with potential impacts that are coming from those exposures. And then we talk about where the data lies for all of those things. And there's a whole section also on indicators and data sources for population sensitivity, right? What characteristics might make us more sensitive or more at risk for any particular vulnerability. And adaptive capacity, which is a term everybody seems to like here because it helps us talk about the positives and the strengths. Where do we already have capacity to adapt things that lower our risk to all of these vulnerabilities? So all of those things are in the easy tool. Can you go to the next slide? And remember when Lori said, don't be scared by small fonted spreadsheets? Well, here it is. I'm not going to talk too much in detail, but what this exercise that we're about to do is going to do is give you a little miniature version of what you would do in the Easy Tool. So the Easy Tool generally is organized by, on the left there, you see exposures. So those 5 exposures you can find on the left. Right next to it is any related secondary exposure. So you're looking at right there, drought. We know that drought in the research is correlated with worsened air quality. In the case of drought, we'd be talking about things like dust and particulate matter. And so here on the next slide over, you can, if you all you did was filter for your region, you would be able to see, oh, not yet. You would be able to see what are some of your most, what does the research say are some of your most concerning exposures, and how do those relate to impacts, which is a whole nother tab on how to evaluate impacts. But this is showing you how we connect exposure indicators. We give you a whole menu of potential ways to measure. So that's what indicators are, right? So here you see annual mean concentration of PM 2.5. That's one way to look for information about the trends associated with worsened air quality related to drought. If we have any national data sources that we're aware of that we would recommend you take a look at, we put them here. If we don't, it means we don't know of a good one for that one. So where there's blanks, it's sort of potentially it means that we have a need for more data, or that we just have a piece of it. In this case, there's a California data set called the Healthy Places Index that we would point you to. And the way this is actually organized, you'll see if you download it, is that we're asking you to look at things that data sets that have historical data, baseline data, meaning more current data, and projected, any projections. So these 3 columns under data findings are places to actually put your work. So this is intended to be a worksheet. After you've looked through all of whatever data sets appeal to you that you think are relevant out of this entire inventory, you don't have to do it all. The idea here is that this worksheet allows you to actually assess an exposure risk level, high, medium, or low, and drop it into those boxes on the right. Okay, that's a really miniature version of the exposure tab. Like I said, there's an impact tab and there's a population sensitivity adaptive capacity tab, and we're going to walk through that in more detail at lunch. Next slide, please. The other thing that the Easy Tool does is captures what we have learned about various adaptation strategies, right? So in this summit, we're not diving too deeply onto the adaptation planning side. So we're talking more specifically about the vulnerability, but of course, vulnerability assessments are meaning to lead you to the point where you can tackle the concerns that you identify in the vulnerability assessment with actual strategies. So these strategies are pulled from best practices around the country, many of them tribal best practices. And it helps you kind of filter and look for some ideas for what kind of strategies could possibly help you address risks in various exposures and various impact types. So there's just some tools here for you. There's some research. The idea here is you don't have to start from scratch. You don't have to start by yourself on where the heck do I go find information. Okay, next slide, please. And so a lot of the stuff you've heard about so far, we keep embedding into the Easy Tool. So CDPH's tools, we've got it in. You've heard about Healthy Places Index, we've got it in. Where OEHA has some good information, we've got it in. CDC, all these places. It's intending to be this one-stop place to start and navigate to some of the other good places. Okay, yes, thank you, Serena, for dropping that link. You can actually go and download it right now for free. It's all you do is download, and I would encourage you to have that handy. So, this, I'm not going to go into detail. A lot of the time we spent at the Tribal Climate Health Project has been in trying to continue to identify where the gaps are for tribes. And there are many. And so some places we just don't have all the time scales that we want. There's no projections at all. In some cases, it's not location specific enough. We wish it went to the boundary of the tribe's reservation or some other boundary. It doesn't. It goes down to maybe state or county or census tract. Sometimes it's not connected enough to climate change and the climate events, like in the case of wildfire and PM 2.5. We don't know, the data is getting better, but we don't always know exactly how to attribute some of the data to a climate event. And the last thing I'll say on this slide is just what we were talking about in the last session really matters here. Tribes want to see more indigenous data that they can trust being used in these models, in the data sets that are made available, not just to be included in a chapter in a report to have a tribal voice there. That's great, but to actually have their data meaningfully incorporated. And that's just a larger, bigger issue. Okay, next slide, please. All right, so let's talk about our activity. Please join me in looking at page 27 of your participant workbook. And I really like you to get there because there are links that I want you to be able to use. We're going to actually have you clicking on hyperlinks and using some tools. So the first piece of this exercise is called your exposure. So you get to look at your own data for your own community. It's an abbreviated version of what you would do in the easy tool. So we actually ask you in this exercise, of the 3 exposure indicators that we've listed here in the table, or of all of them, we want you to pick at least 3 and tinker around with that hyperlink. And at the end of that, we're going to ask you it's not enough information or time, but give it an exposure risk level. So just based on what you learned, is it a high, medium, or low risk? You would never make this decision in isolation with one data set, but I'm just giving you a little proxy, a little practice here on what that would look like. Okay, so actually Serena, she's going to first demo this drought tool for us. It's actually in the Climate Explorer.
Perfect. So like Angie mentioned, hopefully everyone has their workbooks up. And like Angie mentioned, the data in the easy tool is broken down by exposure and impact. And so you'll see on page 29 of the workbook, there's 1 impact for us to go through. And then there are 5, maybe 6 different exposures that we're going through today. So, and just as we all know, exposures focus on the many changing climate conditions and exposures such as heat, storms, wildfire, and the cascading effects on secondary exposures. And so we're going to go into the Climate Explorer. Okay, I'm going to open this up really quick. Perfect. Okay, can everybody see the Climate Explorer okay? So this only captures data for county level climate graphs. And so just be aware. And also the way that the Climate Explorer was created and who it was created for, it was part of the US Climate Resilience Toolkit. And it has 2 different graph projections, one in which humans drastically reduce and stabilize global emissions of heat trapping gases, and one in which we continue increasing emissions through the end of the 21st century. This is a note for the Alaska tribes that are with us today. Only higher emissions projections are available for Alaska tribes. What is available in the Climate Explorer is historical temperature and precipitation observations at hundreds of climate stations and view observed and projected days of high tide flooding at more than 90 coastal tide gauge stations. Perfect. I'm going to put in San Diego County, because that is the county that I live in, into the Climate Explorer. And then for folks who are going to be navigating through this PDF, I'm just doing a demo so you can understand how to get to dry days for the 0.01 inch precipitation. You're going to go to climate graphs. And then once you get to climate graphs, you are going to select right here and choose under precipitation, dry days. And you can see here, when you toggle over the question mark, the number of dry days per year, days when precipitation is less than 0.01 inches, gives a sense of the portion of the year when no moisture is being added to the environment. So I'm going to select this. And then based on this, we're going to get a 1961 to 1990 average, which is 301.4 days. You can see that here. Sorry if it's a little bit small and you can't see it too well. That's something that you can use for your historical data in this PDF. And then you're also going to go all the way into this graph. Right here on the bottom, it says 2090 on the x-axis. So you're going to select that, and you can see how it changes In a higher emission scenario, 312.6 days a year will be will have dry days compared to the 301.4 dry days in the 1961 to 1990 average. So then you can go back into your PDF and then you can enter that in right here. Any questions on that?
This is Shasta. I would just say, I'm going to keep using my game example. You got to play the game to understand the rules. So just play with it, put in your community or the closest community that has this data, because like Serena said, it's at the county level, and add that in for yourself.
Yeah.
All right, thank you, Serena. Serena's around for questions and help. If we need to form a breakout to dive in a little deeper, we can. Now, Claudia, you're here with us, right? You're going to demo really quickly the two CDC queries that we have run here.
I'll stop sharing, Claudia, so you can share, okay?
Sure. Yep. Okay, can you guys see that okay?
Yes.
Okay. I can't see it great. I have this toolbar. Let me move that. So this is the CDC's Environmental Public Health Tracking Network's Data Explorer. And this is essentially a data repository. It's pulling information from different data source, mainly federal data sources, and all of this information is publicly available. Some of the information is being gathered by the tracking program's grant recipients. So it's a mix of data sources, but super helpful for easily pulling both environmental data and health information. So if you go to the Data Explorer, and I know there was a link in that in the workbook to this, but it gives you, it lands you on this page and it gives you, your first question is, what data are you trying to look for? So if you click here under content, the first question, you can select, what you're looking for. And this is not only climate related, this is all kinds of environmental health exposures and health information. So you'll see a lot on here. So the two queries that are that are being asked in the workbook. One is on air quality. So I'll click here on air quality, and then it will let me select an indicator. So on indicators, you have options for forecasted air quality, historical air quality, and national ambient air quality standards. This is the one, actually, if you click on the workbook, it's going to take you straight to the query that you need, but I'm just showing you the options here. The query that's being asked is ozone, number of days over the air quality standard. And we have monitor and model data, and we have only monitor data. So I'm going to click on the model data too, because we really want to get a full picture of the US. So I'll click on that.
And Claudia, I want to note too, in the workbook, it automatically queries to national by county, but folks, you want to do state by county, it might be more accurate.
Yeah, that's a good point.
Yeah.
So national by county is going to give you every county in the US, and you can see we have years from 2001 to 2018. Though if you select state by county, you can select which state you're in, and it will give you, a different picture. So I'll go to national by county. And I'll just hit 2018, I think it was 2002 that was selected. So we can kind of see previous and current, and click go.
I'm just going to encourage folks, as you're watching, try tinkering with it along, right? This is a demo. If you're in your workbook, go ahead and try it.
You can't break it. Try it out. So this is giving you, the legends. There it goes. The legends telling you the number of days that are exceeding that air quality standard number. And if you scroll over, it's going to give you the count of days. So you'll see this is by county. I'm not sure if it goes maybe more downscaled if you go to the state level, though I think it's county as well. for this indicator. Just a little fun fact here, you can also do a different map on the right side to kind of compare. So if you wanted to, for example, look at the impact, asthma in the same area, you could do something like emergency department visits for asthma, do a rate, same geographic, well, national by county. I'll select 2018 and just hit go. So just, something you can play around with. There are times that we don't have data for various reasons. Sometimes, especially with the health data, it's we're given privileges on a state by state level or case by case basis with the states. So that's why there are some gaps. The other query that's being asked is the precipitation and flooding. And so similarly, if you click on that link, it's going to go ahead and give you what it is, but we're looking at precipitation and flooding for the content area, vulnerability and preparedness, and then go to percent area within a FEMA designated flood hazard area. So that's going to give you the percent of, for example, within a county that falls within a flood zone according to FEMA's, flood designated hazard areas. And
Somebody in the chat is asking a good question, and it's a really important point we make right here, which is this data only for 2018? It might be. For this particular query, it does look that way, and that's a big red flag for a couple of reasons. It's super great. At least there's something. All right, we're going to use the best we can. But ideally, you should use at least like a 10-year average to make any sense of the data. You wouldn't want, like, what if some year happens to just be a crazy year for precipitation and is an outlier? You wouldn't want to base everything you know on 1 year of data. So where you can do, the longer the average, kind of the better. The industry standard is really trying to take 30-year averages if you can. So that's where this gets even trickier. You have to, maybe in some cases, you have to do a little math if a tool like this hasn't provided you with 10 or 30-year averages.
So a note about this indicator specifically, all it's telling you is what is within that FEMA designated flood hazard zone. They don't update those very often. So this might be that the latest update is from 2018. I'm not exactly sure, but just putting that out there, that we do try to get these updated with the latest data. There are lags, especially with the health data, of a year or two. And then there are some cases where we get daily data, especially with heat. But I just wanted to note that if you click on the about the data, it will tell you what the source is, what the methods are that are being used. And, you can really dig in a little bit more if you're interested. You can also download the data up here on the export button. So if you want to pull this data and do your own analysis, that's totally, a functionality of this. Angie, anything else you wanted me to cover on the tracking networks data explorer?
No, I want to give people some time to work in it and ask some questions while they do it. So I'm going to give you just a couple of quiet minutes. Actually, what's the timing here? Serena Stewart, do you have our timing handy?
Let me take a look. So we have, sorry, I'll scroll up a little bit. We will be breaking out for lunch at 12:15. So we have 35 minutes total.
Oh, I think I wrote an email with this. Serena Vega, do you have that handy? We had to time this out. At least let's take 10 more minutes on this first piece, your exposures piece. To fill out at least 3 of the elements on that table that you are most interested in, and then take the recording went on and off. Just take a crack at giving yourself an exposure risk level, high, medium, or low.
Yeah.
And we're going to
So
talk
if you
about
have
it.
until 12:15, we can do like maybe 15 minutes if you want. Maybe that's too much.
We still have the impact one to go through.
Yeah.
All right. So you got to 11:50 on this first exercise. Yeah, y'all don't be shy or nervous about asking questions. You could even chat us directly. If you want any help on these tools, this is not easy. We were planning to be in the room with you and circling and coming by to help. So we know this is brand new to many of you to look at these tools. So just let us know.
Angie, should I demo one other tool while people are waiting, or should we just let them focus on their workbook?
Do you want to? Let's wait till we get a question. Actually, maybe I'll take that back, because one thing I do want folks to know that are dealing with wildfire is just my favorite tool for wildfires. Do you want to demo wildfire risk?
Yeah, actually.
And turn your volume down if it's disrupting you.
Yeah,
doing your work.
Perfect. Cool. So this is the USDA and the Forest Service's tool, wildfirerisk.org. The link is going to take you directly to this homepage. And so you're going to press on explore. It's going to load and you're going to enter your community. I don't know how specific it can get, but for example,
What up, Paula?
you want to do Paula?
Yeah.
Great. And we're specifically in the workbook, we're looking for wildfire likelihood. So you're going to click wildfire likelihood right here on the top right. Great. So where is the wildfire likelihood? What is it and where does it fall? So I think modeled here is Los Angeles, California, and Paula is all the way over here in the 99th percentile. It's in the highest wildfire likelihood possible.
I love the visualizations in this tool that you can see your relative risk related to the rest of the areas in the state, and that you can see it on a map with nice color coding.
100%.
Easy to navigate this tool. I think it's really cool. You can go out. Why don't we look at somewhere outside of California? We've been so California centric.
True. Does anyone want to throw out a place that they'd be interested in viewing on wildfirerisk.org?
Northfield, Minnesota.
Northfield sits right here. It's in the
Lori, what's your association with Northfield? Did you go to Carleton or St. Olaf?
No, my kid goes to Carleton.
So greater wildfire likelihood than 14% of communities in Minnesota. Let me zoom out a little bit so we can see the rest of the state.
Can you put
Not so
the
bad.
link in the chat to that, the wildfire one?
Sure.
Thank you.
And again, once you get to that main page, you're going to press the explore button and then you can enter your community.
So not too bad.
Mhm.
You know, if I were looking at this and if this was the only thing I looked at, I was like, okay, well, we have a little risk. It's not the biggest. It's not the most around the country. At least it's relatively low compared to a lot of other places.
And these are helpful snapshots, you know. There is only one.
This tool also, you know, it's not part of our exercise, but it's got a few other ways to look at wildfire, including risks to homes and vulnerable populations. So it's just a good one. But here's an example, right? All of these tools are telling you a piece of the picture. CDC's got a lot of queries, so they're doing a great job. But in some cases, you have to go a lot of different places to start piecing together this picture for your community about your greatest risks. You know, or you don't. You do it as best you can. You go to the ones that you think are most relevant.
So the CDC is moving towards doing more of these data dashboards. that is pulling data that's on the Data Explorer and processing it into like what we think are relevant indicators for different things. We have one on heat, and I know I've presented Angie to your group on the heat and health tracker. So, you know, we're hoping to do more of those. There's an environmental justice dashboard as well. But I think that that's, you know, these data dashboards are super useful, and they've really like become more prolific, especially with COVID. You know, every state has their own now for public health information. And it's super user friendly, makes the data really accessible. So that's a whole nother topic, but something I'm really interested in.
Yeah.
Claudius, I'm sorry if you said this already, but how often is the data behind this updated?
So it's updated 4 times a year. Though there are some data sets that are on a daily or weekly basis, depending on what the data is.
Wow, that's fast. I mean, considering CAL FIRE likes to hang on to their data for a while.
Yeah, they just got that functionality recently, and we've experimented with heat-related illness. So we have national syndromic surveillance data coming in on a daily basis
Well, thank you.
on the Data Explorer. Yeah.
That's cool.
Any other questions?
So, you know, what we're trying to do here for you all is not have you going on a wild goose chase, looking through really complicated academic articles, looking for meaning and trying to apply it and downscale it, any interpretation for yourself, or having to do any really rigorous data analysis yourself, but to find you what we call as community ready data as possible, meaning somebody's kind of done the work to interpret, calculate, interpret, and even potentially visualize and provide a narrative about it. So telling you what this data means, try to point you to those that are most community ready where we can. All right, we got 1 more minute for you. Oh, Melinda, go ahead.
Just a moment, I gotta adjust my sound. So one of the things that I think we're encountering, or we've struggled with in Alaska, especially when we're working with some of our population and thinking about the impacts on our subsistence way of life, is like when you look at the data, and I see where this has moved in that direction. So you, like thinking about the change in the warm weather days, or yeah, I guess that would be a good one for Alaska, and thinking about how, and then mentally thinking, now we've had like our summer of 2009, we had fish die-offs and a great deal of impact on our rivers and our water with the heat, right? Because we had like 3 weeks of extreme heat that then led to fish die-offs around the state. And I think it's the still looking at the data and then saying, okay, if we know we're going to increase in the number of warm days or extreme heat days, what does that actually mean on the ground given our recent experience?
Yes.
And that's
Right.
the piece that I think we still need to like make our mental leap from when we were
Totally.
working on adaptation plans or having dialogues with people. It's not an easy thing to do, but it's because of our more recent extreme events, people conceptualize it more. But that's a factor in here when you're just looking at data. What does it really mean in the experience of people, especially when people are reliant, on the lands in everyday life? So
Yeah, I could hug you. This is exactly where we're at and why. So this first piece is on just exposures, but you're right. And I say it all the time. Sometimes people just leave it at the exposure and then you have to go imagine what might possibly happen. And in my opinion, you don't have to imagine. The research has been made somewhat clear. It's being made more clear every day. So we'll talk next about an impact that we're going to look at. The easy tool is constructed to outline a lot of impacts and to show you where you can find the data for it. But we don't have fish die-off. That would be a good one. Do you know if there is a publicly accessible database for fish die-off, or if it's just something that the tribe has to collect its own data on?
I know that for tribes that I've worked with, it's often better to get local fish die-off data. So like the national database for Clear Lake Hitch isn't very robust. However, there's a gentleman with the Fish and Wildlife Service who specializes in hitch, and he does great work and will give the work to the tribes, and loves partnering with the tribes.
Excuse me. I think that's where it's really critical to have those local observations, right?
Yes.
Yeah, so that, when you've reached 3 weeks of really extreme weather, and then what are people seeing on the grounds with the river and the land they're at, and then matching that, right? Yeah, so that's where it's critical to have that, and then also being able to look perhaps in the media sources for that. Like we had a lot of media that came out of that, and some of that is in like the local environmental network, the LEO network that Alaska Native Tribal Health and our IHS system has recorded. So thinking about how the data can be coupled to tell that story. So thanks.
100%.
Thank you for saying all of that, Melinda. It's a good transition into the impact exposure, or impact exercise we're going to do next. But I'm just sharing with you the impact tab on the easy tool, mostly because I want you to see how extensive it is. So when we learn that there is an impact, a possible impact connected to an exposure, they were basically coding them together to make this a relational database. So, if I were to go try to put fish die-off in here, I would find the right place to do it. And I would want to understand which of the climate exposures are contributing to fish die-off, so that when folks go to look at all the potential impacts of that exposure, it would pop up at least for them to think about. And if all we know to do is to say, we're going to send you, you should go try to collect some information on your observed fish die-off, then we would point them. Then that just means we wish you good luck in finding internal data. If we have an external data source to send you to, we would put it here. But if all you had time to do, like I said, is just kind of filter for your region, you'll have a long list that you don't have to imagine what the impacts are. You'll have a long list that says, all right, show me all the impacts of temperature extremes, show me all the impacts of drought, show me all the impacts of storm flooding. Yeah. And at least you'll have a large set of them. Okay, so you can take the screen back, Serena, if you'd like. Let's talk for a second about that first exposure, your exposure exercise. I just want to hear from folks how that was for you, and what, did you get results? Was it interesting? Was it surprising? Was it difficult? Anybody want to share an experience?
It's okay if the technology was a little bit daunting and if you didn't even try it, that's okay too.
Yeah, we don't have to talk too much. I'm glad we got a chance to talk about the timescales and just using, that you might have to do a little bit of math. Even for the best tools, you might have to do a little bit of math. Serena Vega, why don't you tell us about your experience when I first had you help me with the easy tool, and your experience having to pull off data and try to come up with 10 or 30-year averages.
That was awesome. And I was going to suggest for some people too, like if, for example, in the CDC tool, sometimes you could go in and get 3 to 5 years of data and average that. It's helpful just so you have like a 5-year span of data, that you're not just 1 year, because it can be kind of random. But yeah, I had taken 10 years of data and was averaging it for, I think, at least 10 different indicators until I found out that there's like a high-tech way of doing that. And it's called through the use of APIs. I don't know if you guys know what those are, but it's really awesome and really helpful. Yeah.
And Angie, I'll jump in here too,
Yeah.
just to say that listening to what some folks have been saying, Melinda, I really appreciate your comments in particular. That there's two ways to go about doing this, and right now we're really focusing on the Western science version of data. And Melinda, I think what you're talking about is the lived experience of tribal members and I'll call it tribal science. And that the experiences that we hear about, or even what Lori talked about in her session, hearing from her friend, the elder from the Paiute, that what do you want? Do you want 100 years, or do you want what I've been hearing from my grandparents and their grandparents and their grandparents all the way back? That data is just as significant, if not more significant, because it speaks to people's lived experiences of the fish die-offs, of the berry patches that rot in the sun because of a heat day, an unexpected heat day.
Really?
And that is all data. And you don't have to even necessarily use these tools if you want to focus on what your individual community members have been telling you, and you already know because it's what's happening. So with that, I see that Dennis has his hand up, so I want to let him speak. Dennis.
Oh yeah, I was just going to comment that a lot of times I create my own weather dashboards by using some available data available to us, and I make a spreadsheet type of thing where we use it for our planning purposes, for like how we're going to respond to floods every spring. Not every spring, but just for stuff like that. So just wanted to share that.
Yeah, I mean, at some point, you're probably going to develop a spreadsheet. You're going to need to track this information so you can make some decisions. Yeah, I'd be interested to see your process, Dennis. It'd be great. I'm sorry, folks in the chat are stressed. Don't be stressed. This is just an exercise to give you a taste for what it is like to start dabbling into the data. You don't have to finish it. You can always, do more on your own time. And like I said, join us at lunch if you want to continue the fun, because we're going to talk a little bit more about some of the mechanics behind doing this kind of work. Elroy.
Oh, you're muted.
You're muted.
Good afternoon, everybody. Sorry, I had to jump out for a little bit due to work, but I just wanted to add, and I was going to talk about this earlier. When it comes to sovereign immunity of data, one of the challenges that we have as Indigenous people is that we have to selectively choose what we incorporate into the documents because they're publicly shared. And unfortunately, because of that, when it comes to the root of climate change and our connection with our language, land, and culture, those connections, we can't document that, and a lot of challenges is that I think because at the Pueblo Laguna, we've done a climate adaptation plan, and I can count the number of times that community have actually referenced it, and my job is to try and incorporate and educate them as far as why this is important, because the tribes are dealing with lack of infrastructure, quality of life, poverty, all kinds of things, and so the thought of dealing with the heat, other things in that manner, which is important, which impacts health and other things in that manner, is not really the thing that's forefront, and so one of the things I've been doing is trying to really connect it to language, and relearning our language and incorporate the environmental connection that we have, that our language has with the natural environment and the teachings that are already in there, as other people have stated. But I think it's important as we go forward and move in this direction that we're able to develop plans that not only speak with all the data that we've been talking about, but also incorporate that stuff that where your grandma, grandpa, your uncle can go and pick up the document and say, this is actually useful stuff. You know, this connects to who we are as a people. And so that's just some thoughts.
100%.
Yeah, really appreciate that. I want to mention in the easy tool, and it's not the end all be all, but it's this braided approach we keep talking about. It's not to put, we are not attempting to put Western science at all above what tribes know. In fact, we're trying to just make some suggestions about where tribal observations, and it could be traditional ecological knowledge or more recent observations, where you might consider those when you're looking at each of these exposures. So it really encourages that, where you can plug in whatever information you have. It might be qualitative information. It might be looking at, if you've done a survey or did interviews, you know, where you have quotations or stories that you're getting from tribal members or elders, there's places to put that because it should be considered when you go and look at your risks. Oh, something in here from Eric. Let's see. Interesting that when I was doing research for the new incubation system for salmon, I found red zone, and I learned that he studied the Alaska Native way of basket reseeding our streams after streams died off. Yes. Love to hear more about that.
Wow.
I want
All
to,
right.
I'm going to piggyback just for a second on what Elroy was saying too, and note that the data sovereignty piece is incredibly important. And, you know, we've been fortunate that there's a lot of tribes who have publicly shared their adaptation documents, their plans and their vulnerability assessments, which has been really helpful for tribes. But that there are other tribes, like you said, where this is not, these are things, especially traditional knowledge, that shouldn't be written down and aren't going to be shared. And, you know, obviously that's part of tribal sovereignty too.
Let's talk about the next step in this exercise. So kind of like Melinda was saying, it's good to know your exposures, and then it's really important sometimes to know what impacts those exposures are leading to. Why does it matter? And that's where the real vulnerability lies. Not that if wildfires were just happening, but it didn't create any negative or adverse impacts on us, we might not worry about it, but it does. So what are those negative impacts? What are those concerns? And so we're going to look specifically in this exercise at West Nile virus, choosing it because it's something kind of everybody across the country might need to think about a little bit. West Nile virus is something that the distribution and the seasonality of it has changed. So let's look at it. For this exercise, we're going to assume that your community is at generally high risk for storms and flooding, which is a contributor to higher levels of West Nile virus and temperature extremes as well, which are primary exposures known to trigger higher risk for West Nile virus carrying mosquitoes. Assume that your adaptive capacity, which would mean things like your access to health services or insurance, is medium, and that your population sensitivity is also medium. That just means those factors, remember, we mentioned, you moderate your risk up or down based on how well you can adapt. And if you have any particular sensitivities in your community, just consider those kind of neutral at medium. So we're going to ask you to just kind of look at the data around West Nile virus. And so there's a link here. It's to the CDC. It's not the same tool that we just showed you. It's a different portion of the CDC website. And it can help us find information about West Nile related hospitalizations, right? So if we were looking at the exposure here, we might look at storms and flooding, and then we might look at where are the mosquitoes. But here we're looking at the health outcome or the impact. We want to know how many people have been infected by West Nile virus and have actually had such a bad case of it that they needed to be hospitalized. So Serena, can you click on that? There we go.
So it's going to take you to this page, and you're going to click the national and state map section.
This is called, is this ArboNet? Yeah. Pretty cool site, but this is just another example of how the data lies in lots of places, but you can jump off from easy tool to go find it.
Great. And so West Nile virus is here. There's a couple other mentioned here, but we're going to focus on West Nile virus, and this is human. I guess.
Look across the country, but let's find an earlier year, because 2022, the reason why it's all blank is because it's too recent. There's probably not good data yet.
So let's do 2020 or 2019.
You know, so you could just peek.
Yeah.
All right.
So here's 2019. These are human disease cases.
You know, the longer we go through this summit, the more I think Southern California is a bad place to live. Shasta's right. I'm going with you. So if I were you, you're toggling around in here, look at the different years. Look how it's changing.
Yeah.
Where you live.
It'll tell you
only getting down to county level.
Exactly. It's county level, and once you click on it, it'll tell you the number of cases.
Yes, of course, also bearing in mind that data can be scary when you just look at colors on a map, but look at the key here too. Even though there's a lot in Southern California, most of it is the lightest green, which is 1 to 10 cases.
Yeah.
So it's not like thousands of people. Still scary. I mean, I don't want West Nile virus, but I'm just saying, just because Southern California is all green doesn't mean that everybody has West Nile virus. But you still want to plan for that, because that one person who gets it in your community, you're going to be like, shoot, why didn't we give people warnings of the symptoms of West Nile virus?
Yeah.
Right. So, that's sort of a good example of the risk of not looking at some data. Is just, you might not have thought to look at West Nile virus. And if you didn't think to look at it, then you're not going to include a strategy to try to prevent health outcomes related to it. Or maybe you have something already, but at least it's on your radar.
That's
All
interesting, Dennis. I don't see Blaine County in Montana.
Maybe it was in 2019. Well, that's interesting too. So you can put the mosquito, you can check off mosquito. Let's see what happened. What happens to Southern California when you click on mosquito? Oh, nothing. Oh, see, now
So,
you're like, so many mosquitoes in Southern California are West Nile carriers that they found in a testing program. So even if you're not having a lot of reported cases, you have a lot of infectious mosquitoes. So again, you want to, maybe put that into your plan. Of course, you should be doing mosquito abatement no matter what, because mosquitoes carry all sorts of things.
Right. Yeah, you'd be looking at your mosquito abatement program. What do you already have in place to control for mosquitoes? Does your county already have a mosquito program? They might. Is that helpful at all to you? Does your local clinic, is it ready to treat West Nile virus? Could you think about ways to make sure your community understands the symptoms of West Nile virus so that they know what they have? Because this is a tricky one where people might get misdiagnosed.
Yeah. There's Blaine County.
All right. I'd love to hear people's experience as you're kind of looking around here. And actually, Serena, can you look at an earlier year? I don't know if you did that already, but kind of see how things are changing.
Like 2008 or like
earliest.
Okay. Let's do.
So, the other thing that this example shows us is that there's no projections here. And there's usually, when it comes to health, there's often not any projections. So you kind of have to look at historical trends to say, okay, well, look, California wasn't so bad back in 2003. Isn't that crazy?
Of the country. Yikes.
Yeah.
Right? It's changing. What do the trends look like for you? And, but nobody has any information right now to tell you what the projections are going to look like. Unless Claudia does in her back pocket.
No, EPA has, those kind of projection indicators for health, but I don't know that they have one for West Nile virus.
Yeah, right.
I'll take a look.
Found it. If anybody knows, let me know.
But another thing too to bear in mind is that sometimes it doesn't show it here, but sometimes on the key, there'll be something like data not available, like areas that are grayed out. It may be that, some of these places just don't have testing programs for their mosquitoes. I think human cases have to be reported to the CDC, I think, right? Which is why they show up on this. But if they're doing bird or sentinel animal or veterinary or cases that don't have to be reported, they may not show up in the data.
Yeah, right. Is it mandatory reporting? Interesting. Yeah. These tools are only as good as the quality of the data.
but it still gives you an idea. You know, if you're up in Washington State in 2007, looks like either you didn't have a testing program and no, Dennis, it's lunchtime in 4 minutes.
Dennis is hungry.
We're at 12:15 Pacific for lunch today. So we're close.
I'm looking at the CDC's, I just dropped a link in the chat, but indicator on West Nile virus. I mean, you know, they don't have that many years of data. They only have from 2002. And they note that 2002, 2003, and 2012 are exceptionally high years. So not a clear trend just from this data nationally, but you know, I think sometimes too, what we're thinking about is what indicators are contributing to the incidence of West Nile virus. Is it, you know, increased precipitation events after periods of drought, or
Right.
you know, whatever it might be. And then if we know that that's going to be, if we already have like see that relationship in the past and we know that's going to worsen in the future, you can make these kind of generalizations about where we think this is headed. But two, when it comes to mosquitoes and some of these health effects, there are mitigation strategies to reduce the impact. And it may be that West Nile virus has become something that's more, there's more knowledge about, and it's, you know, there's more information about it, so that there is more testing and people are more aware in their community when a mosquito is tested positive for West Nile virus. And those, you know, efforts can reduce the incidence.
Thank you, Claudia. In our last couple of minutes in this session here, does anybody want to share, you know, did you find anything either in an impact, the West Nile virus impact exercise, or in the exposure exercise that you thought was a high risk? You know, you think your community is in a high risk area? All right, well, that's okay. Let's go to lunch. People are hungry. All right, I want to thank everybody. Thanks to Claudia, thanks to Serena for all your help. They've not just today, but all the time on all this data work. So thanks so much.